This is the PowerPoint for the manual muscle testing lecture for kinesiology. So what is manual muscle testing, or an MMT? It's a measurement used to identify weakness of a specific muscle or a muscle group, but it is not actually a measure of strength. So we're looking more for a deficit in their strength rather than saying that they're really strong. This was actually developed back during the polio era. If you remember back to semester 1, we talked about they needed an objective measurement of how to quantify weakness of individuals with polio. Okay, so looking at their strength deficits. Kind of the downsides of manual muscle testing is that there's very poor inter-rater reliability, meaning that it's not very reliable within yourself. So you can test somebody 2 or 3 times in a row and you may get varying measurements every time that you test them. The other limitation with manual muscle testing is that patients have to have a loss of strength of 40% for you to actually be able to detect it with your hands during this type of a test, which is a pretty significant decrease in strength. Why do we do manual muscle testing, though, despite its limitations? It's cheap, it's quick, it's easy, and the alternatives tend to be quite expensive or difficult to use. And it is generally accepted within our profession and within other orthopedic professions. Some alternatives are something called a handheld dynamometer. It's a very good alternative. It's often used in research type of environments. It's very reliable because it gives you an objective measure of how much force is being output by the patient. It is not reliable at all in the lower extremity. There's been a lot of research papers on that. It's fairly good to use in the upper extremity when measuring strength. It can be difficult to use if you've never used it before. They are expensive to buy, and not everyone is comfortable using them or knows how to use them. Other types of machines that you can use is a mechanical dynamometer. Like pictured here, this is a Biodex, and they're very accurate and they provide very objective measurements of strength. The only thing is that they are very big, they're very bulky, they're expensive, it takes a while to set them up, and they're commonly not seen in clinical settings anymore. They were seen a lot maybe 15 years ago in the clinic environment. Another downside is that you can mostly just test very large muscle groups, so the quadriceps, the hamstrings, the ankle plantar flexors, which is even difficult to test in general. But to isolate a muscle, really a mechanical dynamometer is not the tool that you're going to use. The procedure for getting a manual muscle test grade. So we want to place the muscle in a mechanically advantageous position. So that means we want them to be in mid-range of that muscle length curve that we talked about. There will be some exceptions that do apply, but for the most part, we want to put them in mid-range. We want to stabilize at the origin, and I cannot emphasize enough. We need to stabilize proximally in order to make sure that patients are not compensating and that we're isolating the muscle group that we want to isolate. You also want to make sure that you use proper body mechanics because you need to be able to apply enough force in order to measure their strength. So when you go to apply your force, you want to apply it very gradually and as it increases over 2 to 3 seconds. And then you want to hold for anywhere from 3 to 5 seconds with the maximum amount of resistance that you can apply with the patient. And then you slowly want to release that pressure. You don't want to just all of a sudden apply a lot of pressure. You're not going to get a good response from your patient. Make sure that you cue your patient to meet your resistance or match your resistance. You do not want your patient to overpower you, okay? So how do we know how much pressure to apply? This is a question that people commonly ask when they're learning how to do a manual muscle test. So you apply resistance until you find that the patient is no longer able to hold that position and they start to fail under your pressure. It's often called a break test, so you're applying force until you break the patient, okay? The way that you're applying your resistance should be in the line of pull of the muscle, and you always want to compare to the contralateral side. So typically we'll do the uninvolved side first, followed by the involved side. As I mentioned before, you want your patient to understand that they're not overpowering you. This is not a contest, so give them very clear instructions for what you want them to do. Okay, I usually tell people, your leg is much stronger than my arm, so just meet the amount of resistance or match the resistance that I'm going to apply. So here's the big question is how do we grade these manual muscle test scores? And I have a table here. On the left side we have our numerical score, and on the right side is more of a qualitative score, but your numerical score and qualitative score in each row, they all match up. So a score of 5 is the same thing as a normal or an N score, okay? And vice versa, all the way going down through the table. Typically, I will say in orthopedic settings, I tend to see more the numerical numbers. In more neurological types of settings, I often see the qualitative numbers. One is not necessarily better or worse than the other, however, numerical values are recommended. There are also pluses and minuses that can be added to each score. I will say it is not typically recommended, but I wanted to share it with you guys so that you can see it, and we will talk a little bit about it in lab when we go through our manual muscle test grades. I mentioned this during the range of motion lecture in class. So when you're documenting, you want to denote the score as out of 5, out of the scale, to make sure that it is accurate. So we're going to start at the bottom. We're going to start at 0. So I have the table in the bottom corner for you to visualize. So we're going to start with a grade of 0. And what does that mean? So a grade of 0, or no activity, means that we're not seeing any type of muscle contraction whatsoever. If we were to palpate the muscle, we wouldn't feel anything going on there. And if we look with visual inspection, we're also not seeing any type of muscle contraction. Moving up to a grade of 1, or a trace. Remember, these are the same. So a grade of a 1 means that when you're asking the individual to contract the muscle, we can visually see some type of contraction, or with palpation, we can detect some type of muscle contraction. However, there is no movement at the joint. That is very important. So there's no movement whatsoever, but there is some muscle contraction going on. Moving up to a grade 2 out of 5, or poor, again, those are the equivalent. So that means that if they have a grade of 2 out of 5, they're able to move through 100% of their available range of motion, but it's in a position that is gravity eliminated or gravity minimized. So we're taking gravity out of the picture, and we may also want to put a towel down somewhere for them to either move their arm or leg, whatever body structure it is, over the table or whatever situation you're in to minimize friction, because if they're getting stuck on the table, that's going to affect their ability to move through their range of motion. So I also want to point out that this is 100% of their available range of motion. So if they have a contracture and it's limiting their available range, as long as they can move through the full range and gravity minimized, we'll give them a grade of 2. Now, if they can't go through their 100% available range of motion and gravity minimized, that's where we give them a grade of 2-. So you can see how the minus may be appropriate in some situations. Now, we can also give them a grade of 2+, so they can complete partial range of motion against gravity. So less than 100% of their range of motion, but now this is against gravity. So there is a little bit better or a little bit worse, and that's how we add our plus or minus grade. Moving on to a grade of 3 out of 5, or fair. This is being able to move 100% through the available range of motion with no resistance whatsoever against gravity. And usually I start at a grade of 3. I ask someone to move through their full available range against gravity to see, do they have full range? I haven't applied any resistance at all. Okay. If you were to apply resistance to someone who is a grade of a 3 out of 5, they would break, or they would not be able to maintain your resistance with just minimal amount of resistance that you apply. Now, for a 3-, maybe they're able to move through more than 50% of the range of motion, but less than 100% of their range of motion against gravity. That ends up being a 3-. Now a 3+, they're able again to move 100% through the available range of motion, and they can maintain that position against minimal resistance. Okay, so you apply minimal resistance and you do not break them, or they do not fail the test or move out of the position that you put them in. So moving on to a grade of 4, or a good, I'm going to talk about 4-, 4, and 4+. So a grade of a 4, a patient has 100% range of motion against gravity. However, when you apply resistance, you can break them against maximal resistance, but they can hold against a moderate amount of resistance. And you're probably wondering, what is minimal, moderate, and maximal resistance? And this is something that comes with practice and time, and it depends on your patient, and it depends on the muscle that you're testing. And we'll talk about this a little bit more as we go through different parts of the body. So a grade of a 4-, they can move through the full available range of motion against gravity, but they break with moderate resistance. We're going to give them a 4-. Now, if they can, again, have full range of motion against gravity, they can hold moderate resistance, but they break with max. That may be more of a 4+ out of 5. In this range, in the 4-, 4, and 4+, these measures are highly variable, and there's very poor inter-rater reliability. However, the way that our profession works is we often reimburse based on these manual muscle test grades. So something to definitely practice and get used to, because you'll be using this skill a lot. Our final grade, a 5 out of 5 or a normal, those are the equivalent. This is when they have 100% range of motion against gravity, and when you apply your resistance, you're not able to break them at all with your max resistance. So as hard as you can apply resistance, they will not break. If a patient has limited range of motion, you can also test them, and you have them go to their end range position and maintain that end range position against max resistance. They may also get a grade of 5. With all of these, you want to make sure you're testing contralaterally. I will say I rarely give a grade of 5 out of 5, even at discharge, because, again, we know that someone has to have a strength deficit of at least 40% in order for us to detect any type of weakness. So some final key points to remember. Muscle strength varies between muscle groups. So if we look at the quadriceps muscles, they can produce much more force than something like the finger extensors. Okay, the size of the muscle is important, so the max resistance that I apply to a quad versus a finger is going to be very different. Remember that our manual muscle test grades, there are objective measures, but they are extremely subjective, and the score that we give is to this muscle or this muscle group. It's important to document, to show improvements over time. As we keep mentioning, the reliability, validity, and sensitivity of manual muscle testing is not great. And if we do give a grade of 5 out of 5, it is very likely that we are underestimating the strength of that muscle for that patient. So that is why I often do not give 5 out of 5 manual muscle test grades. So usually where I start when I'm not sure, how strong is this patient, I'll start against gravity first. So I'll say, okay, if yes, they can move against gravity, then they're at least a 3, and then I can start applying different amounts of resistance. If they try to move against gravity and they cannot do that, then no, they're less than a 3 out of 5, and I need to go to my gravity minimized positions.